we are going to discuss Peaceful End of Life by Rutland and more. So my name is Belar Swallow.
My name is Anderson Tumaliwan.
And my name is Vergara Grisel. Without further ado, let's get started.
So, to give a brief summary of what we will report, we will discuss the 5 major concepts of the Peaceful End of Life theory, its nursing interventions, and its theoretical assumptions. So, let's start. To give a brief introduction about the Peaceful End of Life theory, it is designed by Cornelia, Rutland, and Shirley. So this theory is created to provide a framework for the nurses and to help the patients make their end of life a significant experience. And the Peaceful End of Life theory's nursing goal is to improve the quality of life and achieve a peaceful end of life by providing nursing interventions specifically to each individual. And Peaceful End of Life theory is primarily based on Donavidian's model of structure, process, and outcome. So Rutland and Moore incorporated 3 components to make a quality healthcare for the terminally ill patients. So in the theory, the structure setting is the family system. So in the family system, it does not only focuses on the patient itself, but also to the significant others and the family members of the patient. The next one is the process. In the process, it includes the nursing interventions, which are the actions that promote positive outcomes. And these positive outcomes are the 5 major concepts of the Peaceful End of Life theory. It composes of not being in pain, experience of comfort, experience of dignity and respect, being at peace, and closeness to significant others. And we will briefly discuss each one of the following major concepts. So for the first one, not being in pain. So not being in pain is defined as not having an experience of pain physically or emotionally. And basically it means being free from the suffering that the patient is experiencing. And also, not being in pain is the most crucial part of the 5 major concepts because it is at least the least we can do to help the patient have a peaceful end of life. The next one is the experience of comfort. Experience of comfort is defined as being relieved from the discomfort that the patient is experiencing. It is also defined as the state of easiness and peaceful contentment. And also, what makes the patient's life easily and pleasurable. And we should remember that in the experience of comfort, we should always remember that they should not show any symptoms of distress and suffering. And for the next major concept,
Experience of dignity and respect. So in this concept incorporates the idea of personal worth. So according to Rutland and Moore, each terminally ill patient is respected and valued as a human being. So whether they are in their deathbed, they are still entitled for the protection, and also they are still entitled to be treated, or they must be treated with dignity and respect. The next one is being at peace. So peace, according to Rutland and Moore, once again, is the feeling of calmness and contentment, wherein it is free from any form of anxiety, fear, restlessness, etc., etc. So, in order now to achieve the being at peace, the patient must be peace at her 3 dimensions: their spiritual dimension, their physical dimension, and lastly is their psychological dimension. So, ma-achieve daw yun if yung tatlong yun is naging at peace na. So, the closeness to significant other is the last concept of this theory. So, according to Rutland and Moore, closeness is the connectedness to other human beings. Wherein, to achieve this, it involves physical and emotional closeness to the other human being. So it is expressed through warm and intimate relationship toward other people. But why is it important na close yung patient to yan sa significant others? It is important because that dying patient is very vulnerable. They must feel that they are not lonely in their final journey of their life. That's why it is very important. The next one is the two major assumptions of this theory. The two major assumptions, the first one is that the personal approach to the end of life is highly personal experience. So, since it is personal experience, it is individualized per patient, iba-iba siya. That's why the second major assumption is also important. That is, the nursing care is crucial for creating a peaceful end-of-life experience. Why nursing care is very crucial? Nursing care kasi, since we are the nurses, we can manipulate the situation, we can manipulate the environment na pinag-isaya ng patient. And because of that, yung experience of the patient will be better, and also we can attain and maintain the situation, and also we are the one who are assessing the patient. That's why mas malalaman natin what is the perfect treatment plan to that patient. Also, there are two additional implicit assumptions. The first one is that all significant others are important part of the end of life. Bagay naman ang sinabi ko sa last concept, it is very important to the dying patient to feel that somehow meron pa siyang kasama through her final journey, because they are very vulnerable. That's why their family, their significant ones is very important na dapat kasama nila. And also, syempre we nurses, kasama na rin tayo doon. Then the last one is that the goal of end of life care is not to optimize the treatment kasi we don't want to over-treatment the patient. What we want is to provide judicious use of technology and parang tamang amount of technology and tamang amount of component measure of caring, because we want to maximize the treatment to enhance the quality of life and also to achieve the peaceful end of that patient. Next is that. So we are now in the theoretical assertions wherein I will be discussing the interventions or nursing interventions that were further elaborated by this theory, peaceful end of life. So, the purpose of these interventions is for us nurses to have guidelines on how can we manage our suffering patients to make their end of life a significant experience. As per mentioned a while ago, there were 5 major concepts, and these are the NIPC and EEBC. So remember the word NEEBC when we are talking about this theory. N is stands for not being in pain. E is for experience of comfort. E is for experience of dignity and respect. And B is being at peace. And C is closeness to significant others. So let us proceed and explain the intervention. So for the first one, it was said that monitoring and administering pain relief by applying pharmacological and non-pharmacological interventions can contribute to our patients not being in pain. So basically, we nurses have the ability to give not only medication, but we are also involved in giving psychological help, such as reducing the anxiety, the stress, and the fear of our patients. So in this case, we can provide a sense of control in our patient. So the next one is experience of comfort. So the next one, interventions, is about our patient's discomfort. There are some discomfort kasi that our patient feel discomfort because dahil sa may nararamdaman siya, dahil sa environment, or dahil sa mga nag-iisip niya that leads into anxiety. So we nurses, we maximize our nursing care by monitoring, preventing, and relieving physical discomfort. By this, we can assess kung ano nga ba yung mga discomfort factors that contribute to our patient's distress. And we can also give relief. And additionally, we nurses have this responsibility to make our patients feel at ease. So we can do this by facilitating rest, relaxation, and contentment, and preventing complications. So for the third one is experience of dignity and respect. So how can we achieve this one best? So basically, it has something to do with including the patient and significant others. When we say significant others, these are the families or the relatives of our patient. So these people is important in including them in decision decision making, so that we can show to them that we are respecting and we are give value to them. To make our patients feel that we are truly value them, we should nurses be attentive to their wishes, preferences, or needs. Huwag natin sila baliwalain kasi remember that our goal as nurses is to make our patients make their end of life a significant experience. So for the fourth one is interventions under being at peace. So we nurses explicitly can give emotional support in our patients. We can inspire trust, but we should remember that when we are giving emotional support, there are things that we should keep in mind. We should be limit ourselves because there are some holds and advices that can affect the behavioral and mental stability of our patient. So additionally, if our patients feel needs to be with their another caring person, we should provide, because there are some patients kasi that wants to be with their loved ones at the end of their journey. So additionally, providing patient and significant others with guidance practical issues. So we nurses can also give guidance in practical issues such as money and time. For the fifth is intervention under closeness to significant others. So we all know that the loved ones or the family are the most important person or the people of the patients. So we nurses should facilitate participation of significance in patient care. Also, we can have opportunity to have a close to significant others by having an empathy, attending brief worries and questions of our patients. So that would be all for my part.
And before we end the report, the peaceful end of lecture remains a theory because the sub-concepts or the nursing interventions of each major concepts is not specified well enough. It still lacks clinical practice and empirical evidences. Thus, it still remains a theory. And that is all. Thank you very much.